Welcome everyone to the Weathering Change seminar series. Our speaker today is Nikolaus Mezger from the Karolinska Institute in Finland, and he'll be speaking about climate-sensitive health counseling, integrating climate considerations into everyday clinical practice. And I'll turn it over to him.
Thank you, Kermit. Thank you very much. So my name is Nikolaus, as Kermit says. I'm a medical doctor and a public health researcher, and I want to introduce to you this concept that a bunch of colleagues from different universities, including Heidelberg universities in Germany and Halle University in the east of Germany also developed to integrate climate considerations into clinical practice with focus on patient conversations. And yeah, you can see here like different affiliations. I just want to briefly introduce to you like what institutions I've worked with. So I did my PhD in public health at the University of Halle in Eastern Germany, but then I also worked for the German Climate and Health Alliance, KLUK. You can see the logo here. And yeah, I did a research master's at Karolinska Institute in Sweden, which is where I'm currently affiliated with as well. And yeah, so these slides are made with the Halle affiliation, but you can contact me through my email here at Karolinska. And yeah, I'm happy to disclose some conflicts of interest. So I'm a member of two NGOs. One is again the German Climate and Health Alliance, KLUK in abbreviation, and I'm also part of the Planetary Health Alliance based in the US. Yeah, so I will give us a little bit of a background on planetary health and clinical counseling in the context of climate change, with a focus on health co-benefits of climate transformative action in society. And then I will present a study that we conducted and give some prospects. And I'm very happy to answer any questions also throughout this conversation. So please feel free to interrupt me, and I trust the moderators will let me know if there are any questions, so I can also answer any of them immediately. And please write down any comments that you may have. So yeah, so the starting point of most of what I personally do is the knowledge about the planetary boundaries. They were conceived back in 2009 in Stockholm by the Stockholm Resilience Center, and they basically are mapping certain Earth systems and the impact mankind has on them. So you can see that climate change is only one of these Earth systems, and there are a total of 9 of them. And you can see that the safe operating space marked here in the green color, it's unfortunately transgressed for a lot of these planetary boundaries. So basically we are exploiting resources of the planet and of the Earth systems beyond what they are able to regenerate. And this is true not only for climate change and carbon emissions, but also for example, biodiversity or water use. And I will not go more into detail here, but please read on them if you haven't heard. So now we live in a certain time of mankind, which sometimes is referred to as the Great Acceleration. So we can see that on the left, there's a bunch of trends that would usually be depicted as positive trends. For example, we have a lot of wealth and so like depicted by social indicators such as population growth. we see the GDP going up in the last 300 years. And we also see that a lot of energy is being mobilized to sustain our civilization. And on the right side, you can see, however, that we are basically using up a lot of ecosystems. And the link to human health, you can see it here for the example of climate change, but probably there are nice graphs also for other Earth systems and the impact on human health. Some of them have not been mapped as well. For example, biodiversity and its links to human health is an emerging field. But for climate change, we see health risks through climate-related hazards such as extreme weather events, but also, for example, sea level rise. We know that people are not vulnerable in the same degree to these climate-related changes. Some of these vulnerability factors are related to demography, but also to socioeconomic status, etc. And the exposure is not the same for all. So, for example, people working in agriculture, they are exposed to these climate hazards in a different way than people working at the office. So finally, these climate change risks, they result in health outcomes. I think a lot of other lectures that you have in this seminar series, they are focused a lot on these health outcomes of health risks. For example, injuries or loss of homes. We see NCDs on the rise, non-communicable diseases, etc. And of course, health systems are also affected. My presentation today, however, will be focusing on the health co-benefits of climate smart transformation of society. And I want to highlight the plant-forward diet as one of these win-wins. Physical activity as another one, and clean air as a third one, while clean air is tied to physical activity. I will just explain this in a bit. So here we have a slide in German, but basically I think the main message is that planetary health diet, a plant-forward diet, protects both ecosystems on the left. For example, we need less antibiotics if we eat plant-forward diets. We need less land to sustain our agriculture, etc. And on the right side, it helps to normalize the weight. It reduces the risk for diabetes. It reduces the risk for cancer. And this is just some examples of the benefits for health of a plant-forward diet. And the other domain that I want to highlight here is physical activity. So I understand that this audience I'm speaking to today is mostly based in the US or in North America. So I've also lived for some months in the northeastern part of the States, and I know that there's not so much public transport as in Europe, where I am currently based at. But we know that, for example, use of public transport, but also especially walking, cycling, any kind of active mobility is related to both reduction in carbon emission, but also an increase in health. It prevents health outcomes such as cardiovascular disease, but it also improves mental health and well-being. So these two domains are essentially motivating why we in this research group asked ourselves the question, how can we as physicians or health professionals bring forward the health co-benefits of healthy lifestyle and an environmental smart lifestyle. And we call this climate sensitive health counseling. This is not limited to the health co-benefits. There has been a climate sensitive health counseling framework developed and published a couple of years ago by Quitman and colleagues. And you can see the aims are essentially public health aims, but also clinical aims for counseling, which is to protect and promote individual and public health, increase awareness on climate and health aspects, and encourage climate action and lifestyle change. The topics that I brought forward in this framework are on the one hand, the health impacts and adaptation to these health impacts, and on the other hand, healthy and sustainable lifestyles, which will be the focus of the study that I will present, and then also engagement in climate action and policies. Yeah, and on the bottom you see different communication strategies that can be used. I have a slide towards the end of my presentation that goes into detail about these communication strategies, but essentially in this framework we propose health counseling strategies, for example, narrative interviewing or motivational interviewing, but also climate communication strategies such as the one on the co-benefits or the win-wins. So let's think about medical ethics and their application in climate-sensitive health counseling. So people that argue that in favor of climate-sensitive health counseling, they say that climate change is an acute health threat and it's a medical duty to promote health. And they also say that health professionals are in a trusted position in society to address the health impacts of climate change. So they argue we should engage in climate-sensitive health counseling. The contra side is, of course, that climate change is an increasingly politicized topic that might risk the therapeutic relationship that we see between health professionals and their patients and clients, and maybe it can be seen as a form of lobbying. So to synthesize these pro and contra arguments, literature proposes to focus on the health impacts, differentiate between a personal and professional role when it comes to the health professional delivering the health, climate-sensitive health counseling, and align the solutions with the personal values of patients. So this is the starting point to our study, which is concerned with the acceptability of different framings. So it's a communication framing. It's basically focused on like a health communication science, and we did a survey experiment that I want to tell you about. And our research questions were the following. The first one was, how acceptable do patients find advice on healthy and climate-friendly lifestyles in medical practice? And the second one is, are there differences in acceptance with regards to different domains and communication formats? And how our first hypothesis was that the acceptance does not differ with regard to the domains, which I will explain in short just in a second. And the second hypothesis was that the acceptance does differ when it comes to down to the communication formats. So what were our methods? We did a survey design, we did a randomized experimental factorial design. We drew from an online panel of patients drawn from population registries. No, they were not only patients, but they were also they were just drawn from the population registries and invited to participate in this panel. We surveyed a total of 1,500 persons, and this was conducted in 2022. Here you can see the domain and the framing. Here on this slide I call it topic, but it's essentially the domain, which is diet for half of the surveyed population and physical activity for the other half of the population. And the framing was the framing was first health benefits only framing, health benefits plus climate co-benefit framing, and the third one was a combination of the health benefit and the climate co-benefits and the climate risks. So what does this mean? We used vignettes in this survey experiment, and the first vignette which is concerned with the health benefits of a plant-forward diet, reads as follows. Your physician, Dr. Müller, starts the conversation as follows to address cardiovascular disease. To prevent high blood pressure and associated diseases, it is particularly important to eat plenty of vegetables, fruit, and whole grain products. The second vignette that the surveyed participants received was, like in the vignette A, plus. In the course of the conversation, Dr. Müller, it should say, also mentions, among other things, that eating less meat also contributes to climate change mitigation. Why? Because livestock farming produces a lot of greenhouse gases. Dr. Müller says, so eating less meat is first and foremost good for your health, but it's also good for the climate. And the third version of the vignette was basically combining the first and the second and adding, unfortunately, climate change is also bad for our health. In my practice, I see older people suffering more and more from heat waves. Many of my patients with allergies often have symptoms in the autumn and winter. For me, protecting the climate means protecting health. So here you can see basically our approach to this experiment. We gave the participants of the survey these 3 vignettes and asked them to rate them. And we asked them to rate them according to acceptability, and we asked them how pleasant they found the vignette, the counseling for their risk of cardiovascular disease, how helpful they found it, how appropriate they found it, and how meaningful on a scale from 1 to 5. To show you some of the results, to answer the first research question, again, I repeat, how acceptable do patients find advice on healthy and climate-friendly lifestyles in medical practice? So for the 2 domains or topics, diet and active mobility or physical activity, we basically had the same vignette for biking, like cycling or walking. We found that the highest acceptability was found for the health benefits only vignette. So that means the participants, they thought that the counseling vignette that they read, which was only concerned with the healthy co-benefits of a plant-forward diet, was the most pleasant and helpful and appropriate one. The second most acceptable communication framing was the health benefits plus climate co-benefits framing. So when the physician added that their lifestyle is not only good for their health, but also for the environment. And the least acceptable framing was when the physician added about the climate risks, for example, about heat waves being associated with climate change or allergies. This was found in this pattern, most acceptable health benefits only, least acceptable health benefits plus climate co-benefits plus climate risks, in this order for both the domain of diet, but also for the domain of physical activity or active mobility. And here, just to make sense of the numbers, 1 to 5 was the Likert scale, and the maximum of 5 could be obtained if the participant could rated the vignette as pleasant, helpful, appropriate, and meaningful. So to ask the second research question, again, this was about the acceptance not differing with regards to the domains, physical activity or diet. And the second hypothesis concerned with the communication formats. We can see that there's also, when we do a statistical analysis and not only a descriptive acceptability score, we see that the health only framing was more acceptable than the other two that were concerned with the climate change. And even when we compared vignette B, climate co-benefits, and C, climate co-benefits and climate change risk, we saw still a difference between the two framings B and C in acceptability. Yeah, so let's look at different subgroups. We had a total sample of 1,500 participants, and we found essentially a similar pattern. You can just look at the colors here, and you can see at the acceptability on the y-axis 1 to 5. So we see that the health-only framing is the most acceptable in all of the subgroups, in all of the different stratifications, both with regards to the concernedness with climate change. Maybe some of you know about the SASSY scale, SASSY scale, which was developed for US American population. And it distinguishes Americans in those that are alarmed about climate change, those that are concerned about climate change, those that are cautious about climate change, and those that are doubtful about climate change. And we can see that the health-only framing is the most acceptable one, but however, in the doubtful group, it's by far the most acceptable one, while the climate change risk one is by far the least acceptable one. And in those that are alarmed about climate change, the differences are quite small, both in the domain diet, but also in the domain physical activity. And we also asked the participants to rate their political orientation between left and right. And yeah, this was also somehow a pattern between left and right. The people that depicted themselves as politically on the left, they basically found all of the framings quite similar in acceptability. And some of them even rated, as you can see here, there's a minor visual difference in acceptability between the climate co-benefit and climate risk framing and the health only framing in the political left. But in the political right, you could see that people were preferring the health only framing of climate smart lifestyle, with regards to the diet domain and with regards to the physical activity domain. Yeah, so let me move to the discussion. I think there are no questions yet, so I will just quickly discuss what this study could mean. So this is the first study comparing what we call explicit climate sensitive health counseling. Explicit, why? Because it mentions climate change, and the implicit climate sensitive health counseling, which avoids climate change but which has the planned forward diet as an advantage to environment approach in mind, but doesn't mention the word climate change or its relation to health. Our research question was informed by some qualitative survey results we did before. However, we did not have a patient collective, and our sample was not entirely representative of the German population. And yeah, I think it's important to consider this study in the context of different countries, different cultures, different understandings of both health and lifestyle, but also different attitudes when it comes to climate change. This study could also serve as an example to conduct studies in other planetary health domains, such as biodiversity. Maybe you know the German word Heimat, which essentially means home, but it means home like in a wider sense. So one could consider that somebody, for example, from a more conservative political spectrum does not care so much about climate change. What they might care about is where they were brought up. And maybe you have heard about the term solastalgia. That means that a psychiatric disorder related to the loss of environment. We see this in areas where coal mining is essentially making people to move from their villages where they grew up, for example. So if we manage to use a communication framing that might use less politicized wording, for example, the Heimat term, maybe we would find different results to our study. And the take-home message is essentially that climate-sensitive health counseling is very acceptable. We saw high acceptability scores, even though we did find differences in the acceptability scores. It might be wise, according to this study, to look at the patient in front of you when you think about how you deliver the message. We knew this before, but we applied this to the climate-sensitive health counseling framework. Yeah, let me just finish with a few remarks. So climate-sensitive health counseling is obviously not limited to co-benefits of climate-smart lifestyles. It also addresses climate change impacts on health. And in Germany, in the German context, the most important climate change impact is heat, extreme heat. We have seen a lot of deadly heat waves. We have seen a lot of heat-attributed mortality in Germany in the last summers. So actually, this has now led to health insurances reimbursing general practitioners to engage with their patients in climate-friendly and healthy lifestyles, but also to protect vulnerable groups. Yeah, the requirement is just 1.5 hours of training, and the GPs get reimbursed an extra 8 euros per month and patient, which may seem like a small thing, but I think it is still impressive that health insurers are picking up on this framework quite quickly. And we've also seen this not only in Baden-Württemberg and southwestern Germany, but also in some other areas. Maybe you know of Bavaria, where the Oktoberfest is celebrated. They are also picking up on this idea of reimbursing GPs. And I want to conclude my presentation on the application of climate-sensitive health counseling in obstetrics and gynecology. Maybe some of you are working in this field or doing research. I think that yeah, the clinical care of patients with different obstetrics and gynecological diseases is very much inviting to add climate-sensitive aspects to the counseling. For example, in endometriosis, we know that a plant-forward diet has certain anti-inflammatory benefits that could be exploited in the when it comes to climate-sensitive transformation of what we eat. And we have also put forward a framework which is currently under review, where we basically try to explain the applicability of climate-sensitive health counseling in obstetrics, gynecology, and midwifery. On the left, you can see applicability of counseling on climate health impacts and the required adaptation. For example, protecting pregnant women and their newborns from heat. And the touch points in the clinical subjects when it comes to the counseling. And on the right side, you see the healthy and sustainable lifestyles. For example, physical activities, but also the benefits of exposure to nature and outdoor activities. We know that this is related to positive mental health outcomes, for example, and the touch points in the clinical disciplines. I want to briefly touch on the communication strategies that I mentioned this in the beginning, that I would just take this up again, this topic. So for climate-sensitive health counseling, we can use counseling strategies from the health counseling domain, but also from climate change communication research. For example, for the health counseling strategies, we could use motivational interviewing. I mentioned this before, or active listening. Patient-centered communication seems very important. And from the climate change communication domain, we could, for example, use the strategy of being a role model and create space to talk about feelings linked to climate change and the pressure of society to transform and adapt to climate change. Yeah, I'm trying to include this in my teaching when I work with medical students and other health professions. I try them to exercise climate-sensitive health counseling as a way to use transformative learning in my teaching. Here you can see a little graph that I found, which shows the spiral of transformative learning, where we try to transform our being, our thinking, and our acting, most importantly. And I want to conclude with my presentation topic, obviously being part of a broader policy shift when it comes to health systems. And with climate-sensitive health counseling, we can address what WHO has depicted as one of the key domains, addressing the health impacts of climate change when it comes to personal adaptation to climate impacts. And also the third domain, which is promoting the health co-benefits of climate change mitigation in other sectors such as diet and physical activity. Further reading on similar studies working with patient perspectives, and you can see here, and I would like to thank you for your attention and would love to discuss this a little bit further with you.
Okay. I'll take the two questions in the chat box first, and then we'll switch it to anybody that wants to pop on. First question was, how many outcome variables were studied? That they saw climate change attitude was one, but were there others? And do you look at the climate framing on the climate attitude?
Yes, thank you. So let me just read the second half of the question again.
Yeah, I probably should have just kept it with the first one. What was there other variables that you
Yes,
looked at?
so basically we use all of the variables that we had on the participants, which was all among other age, gender, which federal state they were from, the education. And I just showed you basically the more political, variables that we collected, because I thought those might be most interesting. But I think we found that the young and the old ones found it more acceptable, the climate framings, than the middle-aged ones. But I think this would be very different depending on which population you look at. And I guess if we would do this study now again in 2026, maybe we would find like a little bit different results, because the discourse, even in Germany, is shifting about climate change. I think this would be very useful to have some results also from the North American context. And I know that there's also some people focusing on communication and on climate change and health. If you want, I can tell you like what I know about these research groups in the US.
Okay.
But the second question, can you repeat the second question?
The second question was, did you look at the climate framing? I assume the framing of how you put climate in context versus the climate attitude, the attitude towards the climate. I think you were almost answering that with what you were talking about the last part of your answer here. Is what I got out of the question. And if that's not right, you could certainly pop on and ask the second part of that question.
Yes, please go ahead if the person asking this wants to.
Pamadale.
Hi, hello.
Hi there.
Yeah, so my question was just kind of looking at other outcome variables that the group kind of study, and especially because I saw climate framing, and you guys have the outcome variables you look at how this kind of impact. I mean, you look at some findings around the continuum of 5 like SK, maybe doubtful to other, how people kind of accept that. So I saw that, but then I kind of see another one, which is climate, which is attitude by Yale construct. So I was kind of very confused on, is there also another outcome variables that you studied, have the findings, which is okay, but is there any kind of framing on that you kind of very excited outcome you got from that?
Good.
Thank you so much. Let me just share my screen once more. So basically, okay, this is showing my, oh no, this is showing something else, sorry. Let me just use my presentation slides here. Are you seeing? Yeah, so I just want to make clear, so our outcomes were the following. There were 4 outcomes, and they all come down to acceptability. And we asked, the outcomes were the answers to the question, how pleasant did you find this communication format? How helpful did you find it? How appropriate did you find the communication format, and how meaningful was it to you? These were the outcomes, and the stratification was by the climate change attitude. So this is a covariable, if you want, from like a basic study design lingo. The covariate is what we stratified by and looked at the outcome, which is a combination of these 4 dimensions of the outcome of acceptability. And we did basically just summarize these 4 domains of the acceptability. And here you see the Likert scale 1 to 5, and this is stratified for the climate change attitude.
Thank you.
I hope this was more clear.
So the other question was, do you have an idea of how these data could be useful when talking to groups instead of individual patients?
I think this is a very this is an excellent question. Why? Because I think that we should move beyond the individual patient setting to like a more community health approach, which is, I think, more effective and also more appropriate when it comes to both lifestyle and also to protecting from the climate change impacts. But I don't know. I think this is. I think your university is having a community health approach, focus on community health, and I think you should do a study on it. And I think this is also very important for the low resource healthcare settings, where they do not have a lot of one-on-one counseling, but where they have a lot of community health workers, for example, in Sub-Saharan Africa or like India, where, you know, health education works on a more community level. Even in schools, you could think about health literacy strengthening, and you could do research on climate health literacy strengthening. Yeah, I'm not sure how this would translate to a group. And I would love to collaborate or even read on some research on this topic. Myself, I can just share that we are looking at heat and maternal health in Sub-Saharan Africa and conducting a couple of qualitative studies where you know, midwives are scarce in the rural areas of Sub-Saharan Africa, and they have to attend a bunch of you know, pregnant or postpartum women at the same time. So I think the community health education approach makes a lot of sense in these settings where there's a scarcity of health care workers. But even in the high income setting, I think due to the demographic shift, I think it makes also sense. Yeah. So irrespective of the context, I think. Thank you for this excellent question.
One more, if you don't mind, quickly. How much, what are the resources that the PHA provides that would be useful to scientists and people who want to address it from a group level? Do they provide resources?
Thank you for this question. I mean, I think you're asking about the Planetary Health Alliance.
Yes.
I do not work for them. I work with them, and I'm like part of the Planetary Health Alliance. But I do know that they have a bunch of materials focusing on delivery, like communication delivery, on their website. And I think one could, I think they have, like, for example, like case studies that they have published on their website that could be an inspiration for, yeah, future studies. Using maybe a similar experimental design to ours. And I think, I'm not sure where you are based, you who are asking this question, but I think if we can get more context specific, we have more relevant findings for policymakers, you know, if it's a specific group you're looking at, or a specific health issue, or a specific environmental determinant that you're looking at, I think it will be more meaningful. Our study is kind of like almost too general to really prove, and in mine it helps to inform a concept, but does it really impress any clinicians working on the ground? I'm not sure. So I think we need more, yeah, context specific and target group specific studies. Thank you so much.
Yeah, I just joined them, so I was going to asking you for a shortcut if you knew any shortcuts to the resources that they may have, but I just joined.
Let me just see if I can find the case studies quickly. But anyone else that would like to say something, just go ahead.
Nikolaus, this is our Dr. Ardith Morrow. I really appreciate and admire the work. I have two questions, really. One is, in your context, would all physicians in the same clinic tend to have the same climate orientation?
No, of course not.
Okay, so what you know, how would that then impede being able to take a clinical approach?
Thank you. So I think your question is related to the healthcare professionals and their different stances on climate change. And
Yeah.
I mean, we need to look at different aspects of this. I think one is the knowledge about environment and health, or climate change and health, or planetary health among healthcare workers, which I think is improving in some communities. But yeah, I think a lot of us who are attending the seminar are engaged in educating healthcare professionals, so we are working on it. But still, I think the specific discipline relevant knowledge of climate change and health is poor among healthcare workers. So maybe healthcare workers know that heat is bad for health, but maybe they don't know how it is bad for maternal health, and how mother, like a pregnant woman, is adapting, or like how the maternal physiology is changing and affected by heat. What lifestyle is relevant to an older person living in a nursery home, and what the nurse can do to specifically help this patient that you're seeing. So I think this discipline specific knowledge is not as good as the general climate change and health knowledge. So that is one aspect of the answer, and another one is, I think, very much concerned with the agency. So we need to really think about, are we ready to put our knowledge into practice in our clinical work? Do we feel empowered about it? And this is why I think it's good to work with specific case studies to make it more tangible to somebody you want to bring this concept across, to make it more applicable and relevant to the specific discipline that they work with. To empower them. And the third one is, obviously also the political stance. I mean, I try to personally depoliticize environmental issues and their connections to health as much as I can, because I think it's not so much about politics as much as it is about physics and ethics and democracy. At least this is motivating me as much more than my personal political orientation, but obviously a lot of people do, I'm not saying we should convince health professions to vote for this or that party. So I think we should make this concept as relevant to them as we can, to engage them in applying environmental health in their clinical practice.
Thank you. I did have one other kind of question that if you don't mind. So for the patient, when you're counseling them, and if you really limit it to the idea of the specific behaviors, do you think it does them any damage, or conversely the other way around? Is there any particular advantage to helping them change their behavior by bringing in the climate aspect if the behavioral one is the same? Because there's one way of thinking about working on climate change in adverse political circumstances, maybe really just focusing on the behaviors that are wanted and not trying to, as you point out, as your background. But the question then is, if we generally use that approach, does it cause any, does it change their likelihood at all of doing those behaviors? Maybe, for example, if somebody's coming from the left or something like that, does it motivate them more if climate is also increased in the discussion?
It's a good question. So I think the motivational aspect will only be relevant to a minor patient group. So I think what people are most concerned with when they come to see a health professional is their own health and not the environment. So this is why, this maybe contributes to why we found that the health-only framing is the most acceptable one. And maybe you remember our subgroup analysis where we saw that those politically on the left, they found like the acceptability very similar of the different framings. But I think this, like, for the general message of my presentation, I think what is relevant is the majority of patients, and for them, I think health is the most important one. So when it comes to the lifestyle, changes and behavioral changes, I think what I want to add to my answer to your question is that, like, our study was concerned with healthy and sustainable lifestyles, like eating a plant-forward diet or moving more actively and using the car less. But when it comes to protecting yourself from the impacts of climate change, I think it may make a difference to point out climate change. For example, if you take, I don't know, I'm not sure where you guys are from, but if you take like somebody from Arizona and you point out that it's getting hotter in Arizona due to climate change, and you tell them they should drink more and watch after their grandmother that is at home sick. I think if you point out that it's hotter than before, maybe they will more likely acknowledge that they need to do something about their grandmother or about themselves. So maybe in the realm of like climate change impacts and adapting to them, it may make the topic more relevant to the patient. Whereas in the lifestyle domain, I'm not sure if climate change is adding a particular motivation. And I want to also just conclude my answer with the comment that we did not look at motivation. We only looked at acceptability. So we would love to conduct a study on the actual change in behavior, but we haven't received any funds for it yet. So we would like to test if climate change knowledge among patients is actually making a difference in their behavior, but we don't know.
That's an important question. I hope you do get research funds to be able to do that. That would be lovely.
Yeah.
So we have
Thank you.
another question in the chat. In the promotion of improved health, do you think it would be more helpful if health counseling is framed in terms of weather impacts instead of climate impacts? This might avoid the political tone of climate health counseling and ground the medical decision making in the day-to-day experience of weather.
Yes, I mean, I think it makes sense, is my short answer. I mean, the longer answer is that it depends, but I think the weather is what people can feel. The weather is what people can make connect personal experiences to. And I think if you tell somebody in the winter about heat waves in the summer, they may not remember it when the heat wave hits, you know. So yeah, I mean, I think it's an academic question, but with real world relevance. And yeah, my answer, I think, is the weather makes more sense, at least with regards to certain exposures. So when you think about like allergies and the pollen season, at least in Germany, we see that the pollen season is like 1 month longer than it was just a couple of decades ago. Yeah, maybe that sort of exposure may be more relevant to relate to climate change and not just weather. Because, you know, a person with asthma, they are affected not only on a particular day, but, you know, it's more it's more seasonal, and so maybe it's more relevant to them if you tell them about and it's also a chronic disease. So maybe it depends on like which kind of disease you're looking at or like outcome. like a chronic disease, maybe it's more relevant to look at like climate, but I'm not sure. It's a great question though.
Yeah, I think we're going through similar things with, extreme climate versus climate change. And, I think coming up with the correct words in the right situations, it's probably going to be more of an art than a science, that's for sure, especially since it gets into the more of the political realm of things. Is there anybody else that has any other questions before I wrap this up?
No, just thank you for the work, and that's really wonderful.
Thank
Yeah,
you
it's
very
a
much.
very
Thank
interesting
you.
talk. Yes, thank you very much. Appreciate it, and I'll be talking to you soon about summer.
I will just post my email address in the chat. If anybody would like to copy that quickly, to reach out, and I think the recording will be available after.
Yep.
Yeah.
Yes. So, all right. Well, thank you again for your time, and great seeing
Thank you
you
for your
again.
interest.
Yes.
Thank you. Be in touch.
Thank you,
Bye-bye.
Nicholas.
Bye bye.